So now I'd like to hand back to Ranjit and Richard Vines from Rare Cancers Australia, and they're going to lead a session on what I wish I had known upon diagnosis. Ranjit, Richard, over to you.
Thank you, Ruth. Thank you, Esther. That was a sensational session. And I think we could well do with Rabbit Ray in Australia too. I think he's got potential to migrate to a great many countries. And to introduce myself, for those of you who don't know me, I'm Richard Vines. I'm co-founder and CEO of Rare Cancers Australia. And I'm here with Ranjit Kaur, who is the president of the Breast Cancer Wellness Association from Malaysia. And we're just talking not so much about our organizations, but about our own personal experience today. And I'm going to start, and that personal experience, I should explain, is for Ranjit as a patient and for me as a carer. So I will start, and we're just going to have a little chat, and then we're going to do a poll, and then we're going to talk about the poll, and then we're going to do some more, and then ultimately we're going to get to some really powerful case studies. So so settle in, everyone, and I'll start by throwing to the wonderful Ranjit and saying, what do you wish you'd known upon diagnosis, Ranjit? Because it was quite a while ago, and but they're always the challenging times.
I think, Richard, thanks for asking that question. I was just thinking that, at that time when I was told that I had breast cancer or suspected that I had breast cancer, and I was going through the investigations, that was the most frightful and frightening moment, because you don't know anything. And the doctors are using, the healthcare providers, the nurses around you, the doctors were using words that were quite alien to me. And all I had in my mind was, am I going to be alive, or will I be dead in a week or a month or 6 months, because the word cancer was so frightening. Everything stopped for me in terms of just the word cancer, and so there was nothing I could think further, whereas the doctors were talking and I wasn't understanding. I wasn't at the same wavelength as them. I was thinking of my survival.
Yeah, fair enough. I can relate entirely. Sitting with my wife, whenever we go to see an oncologist, and you're not sure if you're understanding what's being said, you're not sure if you should ask a question, because you're not sure if you've checked with the patient whether they want you to ask the question, and you're not sure if you'll understand the answer. It's a very challenging time. I think for me, the one thing I wish I'd known upon in entering the world of cancer through diagnosis was that it's okay to say to the doctor, I don't know, I don't understand. Can you say that another way? You have a right to sit there and say, no, please explain that in English or Japanese or Korean or whatever language you need, but not in technical speak. That's the bit that challenged me when I was doing it. And I think that is the lesson, that it's okay to ask. And I guess we're going to get, Ruth touched on this a little bit before, but and I'll be interested to hear what you think, Ranjit, about why health literacy is as important as we think it is, if that makes sense.
I don't know. I mean, I just think that it's not just for me to understand it, but also for me to participate in my own treatment and even beyond my treatment, to be able to talk to people around me. I mean, don't forget that our community consists of our family, our workmates, our friends around. People will ask questions, and if you don't have answers, you yourself are not comfortable enough to talk about it. So I think that it is important for me to be empowered, for me to also make decisions, not just in my treatment, but also in my decisions when it comes to my own self, my life, my work. Do I have to postpone my time for some time, or do I resign from my job? There are people who just resign from their jobs. So I think health literacy is important, but at whose terms is it? Are we supposed to learn the medical language, or are the medical people supposed to give us information in layman language, in a language that I understand, in a language that makes it easier for me to know. Just to give you an example, a friend of mine was told, she was lying on the couch while the doctor was examining her, and he's already got all the information, and he said to her, "You have carcinoma of the breast." So she didn't understand what carcinoma meant. And how do you decide, how do you sit with the healthcare provider to decide what kind of treatment would work for you? And in another situation was like the physician has informed this patient, and she told me, she said that he told me that I have breast cancer and there are two options for treatment. And he said, "Which one do you want?" And then she turned around and said, "He is not so clever because he can't choose. He's asking me to choose." So I think that it is something that there is a communication breakdown when you have this issue of not knowing. I wouldn't say I don't know, but I would say even the physician doesn't know me enough or doesn't know how much I know. Yeah.
Yeah, absolutely. And they don't know what your view is of how you want to be treated either. And I think the other thing where health literacy really helps is if you have a good understanding of your disease and the treatment program. As you say, there's so many family and friends once you've been diagnosed who want to understand and who want to help, and sometimes who have read something about some strange treatment that you need to convince them perhaps is not exactly what you need. Like running around with a tinfoil hat on is not gonna save your life. It's really powerful. While we're talking, we do need to get a poll started so we can make sure that all of our viewers are with us. So if Sunil, if you want to start the poll and throw the questions up, we can keep talking and explain it as you go. So the first question is, what is the greatest barrier in patients understanding their disease and making informed decisions about their condition? And I'll run through a couple of these and then I'll hand over to you, Ranjit. But when we were thinking about this, we wondered if sometimes pharmaceutical companies and the medical profession seem to think that everybody in the world speaks English. So we were interested in whether language and cultural barriers was a problem. And we'll roll through some of the others while we go, but whether income is a challenge. And I've lost the screen now, but there's lots of languages up there, none of which I speak. So I'll head to you, Ranjit.
Yeah, I can't read any of these, but then if we could go back one slide, Sunil, that would be great. Yeah. So there are so many things here, and sometimes I find that you get while we're waiting for the poll results. So let's just talk about this issue where you have people who are much older than you and I. Richard, you and I suppose, are the same age, right? So we look at people who are older than us. They're much wiser. Don't underestimate them. People of our parents' age are much wiser because what they did was, when they were diagnosed, they just shifted the responsibility to somebody else and said, since I don't understand, I give the responsibility to my son or somebody else to decide. And that person is totally equally ignorant and starts to ask the doctors questions, and whatever information they can get, they will work on it. So I think that there are different kinds of barriers that we will be facing when we go through such a situation in our communities. And so we'd like to see what the results are like. So we know that the poll questions, the answers are out. Shall we take a look at that, Richard?
Yeah, great. Let's have a look.
Oh, here we go. What do we see now? Okay. So the highest is high use of medical sophisticated terms by healthcare providers. So that's interesting, Richard. I think we have been talking about that.
Yeah, I think it's really important that we manage to convince healthcare professionals, doctors, nurses, to talk to us in terms that we understand. And I remember one time sitting with one of a leading clinician, and he said something, and I said, I don't understand what you just said. And he thought I was joking. He thought that everybody knew that the term that he used, which was really very technical. And I had to explain to him, no, I really don't understand. You're going to have to take me back and tell it to me like I'm a 3-year-old. And the other one, I think, Ranjit, is this lack of time with clinicians, and that's come up second. And so often can you be in a room and you feel you're being ushered out of the room before you, and you've still got questions, and they've got their schedule, and they've booked their patients too close together. It's really interesting. I'm really interested that the one that's getting 0 is lack of interest from patients.
Yeah, I was looking at that, Richard. I was looking at that. So that's the flip side of it, that people would have, I mean, who would have thought that the patients don't want to know? Every patient wants to know, but there might be also the fear of knowing. There is that deep psychological fear, but still patients want to know because they have to go through it.
Yeah, absolutely. And I'm pleased too that language and cultural barriers did not show up quite as high as I thought they might, which is great. It means that we're presenting information across multiple countries in multiple languages.
Yeah.
And I think that's really important. So I think we've got a second poll question, haven't we, Ranjit? Which I think we can put up now, which is a word cloud question.
Yeah, let's go.
Sunil.
Yeah, while they're getting that on, I was just thinking that this is not just for treatment, but it's also for clinical trials. We can talk about that later when we have more time. So what would help resolve these barriers for patients? 1 to 3 words is what we need as the answer.
And we'll form one of those magical word clouds, which will be a technological triumph, given that we're doing it in about 7 languages. So that will be pretty impressive.
Yeah.
And I think you're right. I'd be really interested to come back to this discussion around clinical trials, because when people enroll on a clinical trial, they're sometimes confronted with, a 20-page document that they're supposed to read and understand and sign. And it's quite challenging and quite intimidating. So it will be good to come back to that once we get the word cloud up.
So
here comes,
results.
I think,
let's see the results.
Excellent. Hit us, Sunil.
Education. Simplify medical terms.
Yep.
I like the word education, Richard, because when I use the word education, I think of it as, previously I used to think of educating the patient, but now I think of it as educating both sides. It's educating the healthcare providers as well.
Yes, I think that's right. We at Rare Cancers, we wrote a report last year called The Rights and Roles of Patients. And so much of it was about the way in which doctors communicate with patients and what they choose to tell them and what they don't choose to tell them, and making sure that clinicians, doctors understand that patients have a right to know as much as they want to know. And in circumstances where people have not spoken about treatments that are not available through the normal health system, that might be paid for separately, or not knowing about clinical trials, that none of that is acceptable. And I don't know how clinical trials. What's your experience with clinical trials?
I think that what I have asked those who have been recruited into clinical trials is that, what did you understand in the document that you went through to sign? And they said, they usually say, I read the simpler parts, and the ones that I don't understand, I just omit that and I just carry on. And then after I go through a few pages, I say, what the heck, just sign it and get going with it, otherwise it will take me ages before I can understand everything and be able to, and by then, they will not even recruit me. So I had one friend who said that to me. But I also think that healthcare providers, physicians and doctors, they actually struggle with wanting to use, they don't know how to simplify the language for the patient. I think they struggle with the language at times. I noticed that about them because they are so used to using those technical terms that they fail to realize that the members of the public will not understand the words that they are using. So I think it is a two-way thing. Like you see the word communication coming up. You need to communicate at both levels in the sense that the healthcare provider or the physician needs to ensure. And I at one time asked some physicians that how do you make out that the patient has understood? And they say, yeah, the patient nodded her head. And so I know that she understood. But we in the Asian and African communities, we tend to nod our head to everything. Even if we don't understand, we nod our head. We are always nodding our head, and if you ask me to explain back to you what you said, I may not even be able to say it. So it's just a natural reaction.
Yeah, and it is, I think two things. One, I think is we shouldn't underestimate how complicated it is, because it's not just your clinician or your oncologist that's treating your disease that you have to engage with, but there might well be at various times a surgeon, there might be a radiation oncologist or a radiotherapist. There could be, for pain management, there could be an anaesthetist, and they all have complexities, and you have to engage with all of them, and you're trying to understand all of the implications of these treatments, and it's so difficult.
And don't forget, now with upcoming, situations in our countries, genetic counselors have joined the gang as well. So, they too will actually struggle with trying to explain the family tree and, about the whole thing about the genetics and counseling the patients, especially when they're totally lay people. So, yeah, I mean, we're adding on more and more people to the bandwagon. So we need to make sure that there is a great deal of involvement of the patient and the patient community, the patient's family, so that they understand the whole thing at their own terms and they get the time to get the answers, whether it is in some format that what Esther had shown, or even in a booklet form, or even if you have like a focus group discussion of people in a group situation where adults are sitting and asking questions and getting answers, and you have the healthcare provider and you also have a patient advocate sitting together to make sure there is a meeting of the two in terms of language.
Yeah, I think that's 100% right. And I think one of the things that we're seeing in Australia, and I think more around the world, is that people are beginning to understand that maybe not every clinician's going to have time, and that's where patient groups and patient organizations start to play a role in that our support team can take the time to work through with a patient or a carer and explain things that the clinicians either don't have the capacity because they're too technical or don't have the time to explain. And they can spend time with families and friends too, and make sure that everybody gets a bigger and better understanding. And I know that your organization's done a lot of work in this area, and we're going to talk about it later in the program, which is fantastic, really, really good stuff, because we're not going to, I think I remember, in one Asian country, the average time for a consultation with a clinician was about 2 to 3 minutes. They were just being filed through, and no one's going to explain much in that time. But the organization, the patient organization, was then taking the patient and working through it more slowly, which seemed to be a really constructive and meaningful way to do it. And
I think the other group, Richard, I would like to add is like patient navigators who may be healthcare providers themselves, peer navigators who may also be people who have gone through the experience and they are trained to provide support and navigation to the patient and explain things to the patient. So I think even this aspect is very important, because patients are told by the physician that we want a shared decision, but patients need to understand before they can make the decision together with their physician. So I think we have a lot of resource around us, which are patient organizations. We have navigators either in the community or in the hospital that can also enable the patient to try and overcome the issue of physicians not having time as well.
Yeah. Yeah. And before I forget, I should, we're nearly at the end of our time, but there is a facility for people watching to ask the speaker. You can put your questions in, and after we get through the next two sessions, I think we're going to have a Q&A, facilitated Q&A. So if you've got questions or you want to explore some of the things we've been talking about in more depth, then please jump in there and put your questions in. No question too hard, no question too easy. We will do our best to handle them all. Yeah, so that's great. And I think the most important thing about health literacy is if we don't improve it and we don't get it right, then it's very hard for patients to participate. I'll let you close it out if you like, Ranjit, before we go to, and I'll introduce our next speaker after that.
Yeah, I think what we would like to know, what we like to do here is that to say that for a patient to, and the patient's caregivers to participate in the entire diagnostic, treatment and beyond treatment process is to be able to understand every single thing about the disease, so that the patient, actually that's when the patient gets empowered. When the patient is empowered, the patient is not fearful. There is no fear, there is no anxiety. Anxiety is reduced even for the doctor and the patient. For both of them, the anxiety is reduced because you've got a satisfied healthcare provider, you've got a patient that is doing well, and quality of life for both patient and doctor is super good.
Yeah, fantastic. Well, that's been fun, Ranjit. And look, it's now my great pleasure to introduce Dr. Emily Isham. And Emily has I'll let her explain her broad and deep experience with cancer and all that her health literacy meant through the process that she has experienced and explored. And I think all I have to do now is say, here's Emily. I think I've done.